Good afternoon. This is Julie Kennedy with a recap of the Grand Rapids Public Utilities Commission regular meeting on January 24th. Our meetings changed here starting in 2024. Our regular meetings are the fourth Wednesday of the month at 4 o'clock. So here we were today with our first regular meeting of 2024. Regular business went pretty quickly in about the first 15-20 minutes, going through a number of minutes and consent agenda items. And then we spent about the last 40 minutes hearing from our Water Wastewater Department Manager, Steve Matson, talking about our Legionella communication. And so Legionella is a bacteria that is ubiquitous and found in public water supplies in low concentrations. We have had that in our groundwater and our water, no different than any other public supply. But what we have seen here in 2023 is an uptick in the cases of Legionnaire's disease, and that's a pneumonia-like disease that is caused by that Legionella bacteria. So we've been working with the Department of Health since last July on trying to deduce where that came from. Department of Health looked all around the area. Typical sources are cooling towers, fountains, hot tubs, things like that, because the way that you get Legionnaires from Legionella is actually the aerosolization of that water vapor. It isn't anything that you can get from drinking the water, but it's more of the mist form coming in a shower maybe, or in a hot tub vapor or something like that. And so Department of Health this last summer and fall looked all around the Grand Rapids area, could not find commonality from an exterior source that was aligned with those cases. And so then they turned to us as the public water supply and started working with us to try to see if there is some connection to the cases with respect to the public water supply. So we tested here in December. Department of Health did some testing in December, and they did not find any of the LP1 or the bacteria that leads to Legionnaire's disease in our water treatment plant or in our distribution system. That's typically because our water is moving and is quite cool in the 50s and 60 degree range, and Legionella bacteria needs to be above 77 degrees to really proliferate. But where it was found positive is in some of the premise buildings that were on our system. And so because they did find that in 2 buildings in some of their samples, we are working with them on some mitigation efforts that will prevent or minimize the risk entering those premise buildings. And that is looking at, on our side, looking at chlorination. And so our water treatment plant, as most of you know as customers, we do not chlorinate our water. We've been very proud of that for decades. We're one of the few in the state of Minnesota that do not chlorinate. At this point, we will be moving forward on a long-term process. We will be looking at chlorinating our water. Now, chlorination does not remove completely the risk of Legionella. Again, there are systems out there that are chlorinated that provide water to a building, and then it becomes stagnant and heated in that building, and it still can, the bacteria can still proliferate there. And so it doesn't completely reduce the risk, but it definitely minimizes it. And so we at the utility here are going to do everything we can to help minimize that risk, and then we'll be looking to our customers and our commercial buildings to help us with that as well. So there is not, again, a risk of drinking the water. That is not what that is not how it is spread. The Legionella bacteria is only spread through that aerosolized vapor. So again, not found in the public water supply. There is no risk at this point of any kind of emergency for drinking water. That is not the case at all. But if you have questions, certainly give me a call. Julie Kennedy, Grand Rapids Public Utilities General Manager. My email is jakennedy@grpuc.org. My phone number is 326-7687. I hope that helps. Thanks, and we'll see you soon. Have a good month.